Concerns have been raised of the possible underreporting of side effects to COVID-19 vaccines administered locally. The South African Health Products Regulatory Authority says information about reactions to this jab, but also other medicines, are very low in this country. Fewer than 100 cases of adverse reactions have been reported since May. No deaths are linked to the COVID-19 so far reported today. eNCA's Heidi Giokos has the story.
The vaccine is safe. A full investigation by the South African Health Products Regulatory Authority has found that to date, no one has died after or due to the COVID-19 jab.
Up to the 31st of August, 86 reports of deaths reported following vaccination. And then they, as I explained, must all be investigated. 46 cases are still under investigation, and 40 have been investigated and causality assessed. Now, amongst the 40 that's been causality assessed, none of those were related to any of the COVID-19 vaccines we are using in South Africa. And as you can see there, 13 of them had died because of COVID-19 disease, and one of the cases was actually a breakthrough infection. So these people who died because of COVID-19, they had already incubated COVID-19 at the time of vaccination, or they contracted COVID-19 shortly after being vaccinated.
The regulatory carries out lengthy processes investigating reports of possible deaths and serious adverse reactions due to the COVID-19 jab.
There are any other qualifying factors. So, did this occur with this person in the past? Did this occur independent of vaccination? Could this event have occurred in this patient without him or her being vaccinated? Is that possible? Also, then you would look at, are there any pre-existing conditions or risk factors that could have contributed to the event?
Meanwhile, SAHPRA is encouraging everyone to report any adverse reactions to the vaccine on established platforms to avoid panic and misinformation.
If you look at this and you compare this to about 15 million vaccine recipients, you'd realize that this shows that there's still lack of reporting, there's still low underreporting. So we would prefer that we download the MedSafety app as South Africans and we use it not only for adverse events following immunization, but also for reporting of any suspected adverse drug that one may have experienced after taking their medicines.
The Health Department, together with the medicines regulator, says each case is unique and specific to an individual. This is why they should all be reported and investigated. Heidi Giokos, Johannesburg.